In this episode of Ask Me Anything, I got a question from Mel in North Carolina that has been dealing with a low back injury and sciatica pain. The question was, I just turned 34 a few weeks ago, and I have been dealing with low back and sciatica pain for going on 2 years now. I originally injured it 2 years ago doing some heavy deadlifts at CrossFit. I had an MRI done about a year ago that came back relatively normal with some minor disc bulges, but no nerves getting pinched. I've had 2 epidural shots that might have given me relief for about a week at most. I was seeing a chiropractor 2 times a week for adjustments, but after 3 months, it wasn't getting any better, so I stopped going. I saw a total of 4 physical therapists. The first 2 were in person, and the other 2 were coaching me online. All of them told me my pain was coming from my core being weak, and the goal would be to strengthen that and the back pain would get better. The orthopedic said the same thing, and nothing on my MRI explained all the pain I am having. I have been religiously strengthening my core, but it always makes my back hurt more. Is it just something I need to work through to get better? Is there something else causing all the pain? Is all this pain simply just my core being weak? I just want to know what is going on and start feeling better, because being in pain every day sure does suck the energy out of me. I appreciate any different perspectives or insights you might have. Thanks for the question, Mel, and let's see if we can get some answers about what is going on and on the path to getting rid of that pain. I hope you learned something new and enjoy the show. Welcome back to the Injuries Explained project, where we are on a hell of a mission to make chronic injuries obsolete by helping anyone that is injured and in pain get properly educated and informed on all their treatment options so they can have the best possible outcomes without ever having to resort to pain pills, injections, or surgeries, which only make things worse. My name is Dr. Matt Maggio. I am a soft tissue injury treatment specialist with a focus on neck, shoulder, and sciatica pain. I am an expert at diagnosing and treating scar tissue and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which will lead to a significant increase in overall functioning and long-lasting pain relief. No gimmicks, just results. Thanks so much for stopping by and checking out the show. Just a quick disclaimer before we get started. All of the information presented in this episode is strictly my opinion and in no way, shape, or form should be misinterpreted as concrete medical advice or recommendations. If you're currently injured and in pain, please reach out to a qualified medical practitioner for a full diagnosis. If you've already done that, you haven't got any real answers, you're frustrated as hell, you just want to know what's going on, you can reach out to us directly and request an injury consultation. All of the information to do that is available in the show notes or wherever you might be consuming this information. Now that we got the boring stuff out of the way, let's get right into the show. As I said on the last episode, AMA is definitely becoming our most popular. And just a quick reminder, you can send all your questions in to ask those questions, and all the information to do that is available in the show notes. And I'll try my best to answer each one, but we're getting pretty backed up there. There's a lot of people kind of getting screwed over and lied to by the medical model and just lots of problems. So I'm getting questions like crazy, and I'm going to try my best to answer these the best that I can. I really only have time to do about 1 of these a week. Hopefully I can find some more time and we get more of these answered, because I just want to help you people just get some real answers about what's going on so you can stay the hell away, like I said, from pain pills, injections, and surgeries, and just the broken medical model that not only just makes things worse, it destroys people's lives and just causes a lot of problems. So just a quick reminder, I'm not giving any direct advice or certain recommendations. Instead, this is going to be my opinion of what I would do for myself in the same situation. There's a lot to break down here, and it sucks when I hear stories like this, and so many people are just failed by the medical system. And I mean, this person here, Mel, she's only 34 and dealing with this already. And like, that's the problem that we run into. And I say this a lot to my own patients in my own office. You know, we tend to think where we're at right now with our injury is the worst that it's ever going to get. But The thing is, the only thing worse than where it is where it's going. You start adding 5, 10, 15 years on top of this and you're already having pain, it's going to have a lot of problems. So the first thing I talk about all the time, and what happens when I evaluate a client, is we need to get to the root cause of what's going on. It's very important to have an accurate diagnosis. What happens in the medical world, essentially most doctors and practitioners are diagnosing based on what the insurance company will cover instead of what the actual problem is. And I always say, you can't fix a problem if you don't know what it is in the first place. So we have to know exactly what's going on. And things like, they say a lot of things for like low back pain. They'll say like non-descriptive low back pain or sciatica or something like that. It doesn't tell us anything that's going on. So let's break down the 4 types of providers Mel has already seen and where they missed some key pieces. Let's just start with the chiropractors. I've been very open over the podcast and over the years, that chiropractic adjustments really don't do anything and they actually make things a lot worse. The only thing a chiropractic adjustment has really been shown in studies to help with is like a short term, they call it an acute episode of low back pain. And it might help with that a little bit, but if that is the case, a lot of times it just gets better on its own. And the whole idea that like the bone is out of place and it's pushing on the nerve and blah, 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 blah. All that stuff is nonsense. I never recommend chiropractic treatment, especially chiropractic treatment that only does like adjustments or what's called traction, where they pull the spine. It doesn't do anything. It doesn't fix anything. It's temporarily like at best okay, but it's not actually fixing anything. And that's coming from somebody, myself, that has a chiropractic degree. I spent over $150,000 learning how to be a chiropractor, and I don't even adjust. So if I'm telling you it doesn't work, then you should listen, because I'm a different perspective on that. I got nothing against the chiropractors. It's totally fine, but it's not actually fixing the problem. The goal of the treatment should actually have a treatment that's going to fix the problem, not just temporarily help it feel better. So you have to keep coming back. Next thing is just the orthopedic doctor. The problem for Mel is she's still young. She's only 34, and getting a surgery approved through insurance is going to be pretty hard. And these low back surgeries, they can range anywhere from $60 to $80 to $100,000. They're not cheap. But the problem is they don't even actually work. And there's a whole new diagnosis code called failed back surgery, because people had all these surgeries and it didn't fix anything. I cover that in some older episodes in the podcast, if you haven't gone back and listened, where I talk about surgery and the risks and the benefits and if it actually works. Go back and listen to that. It really dives in a little deeper. That's why I did those first, I think, 8 or 10 videos, to kind of give some context so you can always go back and see where I'm at, so I don't have to keep drawing on about why surgery is bad, why chiropractic doesn't work, why physical therapy doesn't work. You can have that resource there and you can go and really nerd out about what's going on. And the other problem for the orthopedic doctor is Mel's MRI isn't bad enough. She said there was some minor stuff in there, but nothing too bad. Just a quick side note on MRIs. There's 2 sides of the coin in the medical world. There's one side where the providers look at it and they say, oh, everything has to be explained by the MRI. That's usually the orthopedic doctors. Then there's the other side. It tends to be more like physical therapists and things like that. They're like, oh, your MRI doesn't matter. Like just because you have disc problems doesn't matter. The problem is it's somewhere in the middle. And if a client or patient is having pain, the discs are definitely an issue, especially if they show up on an MRI. But they're also not everything. And a lot of times when a radiologist reads an MRI and they see how old this person is, they're only 34, they think a lot of minor stuff isn't really a big deal. So they kind of downplay, because Mel's younger, she's only 34. So things that might not look that bad, they're like, minor bulging, nothing real significant. But here's the thing. This person has been in pain for 2 years. They're showing signs of degeneration to the discs and the joints. That is a problem, because they're in the office. A lot of these therapists, they'll come out and say, they're like, oh, your MRI doesn't matter. The regular population has disc bulges too, but the regular population doesn't have as much pain. This person has been seeking out care for a while, so the disc is an issue. And another thing, Mel noted that she had gotten a couple epidural shots and maybe like a week of relief, if that. I've covered that a lot more, especially in episode 3. I think it was cortisone shots and epidurals. And I'm going to stand firm on my idea. Epidurals and cortisone shots are garbage, and so is the doctor giving them. And then lastly, sorry. 2 more to go. I broke this down into 2. Sorry about that. In-person physical therapy. Honestly, I've talked about what I think about physical therapy. I covered that in a prior episode as well. I look at physical therapists as just a higher paid personal trainer. They're full of what I call simplistic thinking, that just because the muscles are tight, they need to be stretched. And just because the muscles are weak, they need to be strengthened. The real question to ask is, why are the muscles tight? And why are the muscles weak? But they like to do a very reductionist approach. I did a full dive into a physical therapist, one of those early 8 episodes as well, where I really dove into there as well. And then the last one, the online physical therapists. Honestly, these are the worst of the worst. I can't stand these people. I see them all the time on social media telling people how to fix their own injuries. They think that you can fix a complex problem, like a disc problem, scar tissue buildup, all this stuff with just some simple exercises, or they show you how to use a foam roller or a lacrosse ball. It's just complete nonsense. And these people are all over the place. They came out more on the surface during like COVID. They wanted to like have an online business where they just have you do a bunch of exercises and don't do anything. I always say, think of the injury, especially in this situation. Mel's been dealing with this problem for 2 years, seen multiple providers in a lot of pain, affecting your quality of life. This is a big problem. It can't be simply fixed with just some stretching and foam rolling and jamming a lacrosse ball where it hurts. The injury is, like I say, like a really bad cavity that needs precise and focused treatment. And these morons that are showing people how to fix their own injuries online would be like someone trying to show you how to fix your cavity online. You'd be like, that's crazy. But this is what's happening when you try to have one of these online personal trainers or physical therapists fix your problems. So what's more likely going on here in this situation? I think there's 3 problems here. The first one is it all started with some scar tissue buildup. I've covered scar tissue more in depth. I think that was episode 2 or 3. I can't remember which one. But basically it's building up in 2 areas. One is going to be around the low back, and then the other one is going to be deep in the glute muscles, deep in the butt. Eventually what happens is those muscles get more and more of that scar tissue, and it causes the sciatic nerve to get stuck. Now, when the scar tissue forms, the muscles become less flexible and they become weaker, and eventually they get stuck to the nerve. When this happens, it causes a lot of pain. It causes spasms, it causes tightness, it causes numbness and tingling down the leg. So now there's scar tissue in the low back, there's scar tissue in the hips, there's scar tissue around the nerves. Now the muscles can't do their job, which they're supposed to do, which is to support the spine and support the joints. So what happens now is it puts more force and more pressure and more wear and tear on the disc in the joint. And then that's what happens with the disc bulging, and then eventually bulges become herniations, and then herniations become protrusions, and then things are real bad. Then the disc is getting upset, getting angry. And then what happens is a ton of inflammation kicks in to try to help ease the area and buffer the area and keep it from getting worse. But that's where the pain gets worse and worse, and it never really seems to get away. So what happens in this situation is it feels like the core is getting weak, but what it's really trying to do is unload those muscles in the spine and the joint. It's basically called what's protective tension. Protective tension is just your body's way of not getting the nerves or the joint or the disc damaged anymore. The best example I can give of that is like, say you sprain your ankle, your body starts to limp. It's trying to unload that area. That's the same thing that happens when you get like a back spasm or the core feels weak. And then what happens is now you do the exercises, and temporarily it might feel better in the short term, but then it actually exposes that disc and joint some more, causes a lot more problems. This is why the exercises are making it worse. So starts with scar tissue, then the scar tissue gets into the nerves, then the nerves get caught. Then when the nerves get caught, the muscles tighten up. Now the muscles can't do what they're supposed to do. Then puts more pressure on the disc in the joint. It isn't just one thing. And this whole idea of like, oh, it's got to be this one thing and it's just got to be a weak core and causing all that. It's just the biggest nonsense I've ever heard, because it doesn't actually get to the root of what's going on. I'm looking at the clock here and I realized this is getting a little longer than I anticipated, and I don't want to lose your attention. So what I'm going to do is I'm going to actually break this into a 2-part series. And on the next episode, I'm going to dive in deep to what the treatment process would look like to get long-lasting pain relief and function better. So be sure to check that next one out. In closing here, if you like the show and it can help somebody else out, share it with them and share it with other people that it can help. If you have any questions you want me to cover in Ask Me Anything, send them in. All the information to do that is available in the show notes. And then if you're tired of getting jerked around by the medical system and you want to know what's really going on, you can reach out for a direct injury consultation with me and get some real answers about what's going on and get on the path to getting this problem fixed and functioning and moving better. And all the information to do that is in the show notes or wherever you might be consuming this podcast. I appreciate you guys listening, and I'll see you on the next one. Bye.